Throughout history, humanity has been haunted by plagues. These infectious diseases have swept across continents, leaving behind a trail of death and devastation. Plagues are more than just biological events. They are historical turning points. They reshape societies, alter economies, and leave lasting scars on the collective human psyche. Understanding plagues, their causes, and their impact is essential for navigating the future of public health. From the Black Death in the 14th century to the COVID-19 pandemic in the 21st century, plagues have been a constant threat. Each outbreak has brought unique challenges, demanding innovative solutions and global cooperation. The study of plagues reveals the interconnectedness of human societies and the delicate balance between human health and the environment. It also highlights the importance of scientific understanding, public health infrastructure, and international collaboration in mitigating the impact of these devastating events. The lessons learned from past plagues serve as a guide for future preparedness. By understanding the successes and failures of previous responses, we can develop more effective strategies for prevention, containment, and treatment. The history of plagues is a stark reminder of the fragility of human existence and the importance of vigilance in the face of emerging infectious diseases. It is a call to action for global cooperation and investment in public health infrastructure to protect ourselves from the next inevitable outbreak. The Black Death, a bubonic plague pandemic, ravaged Europe and Asia in the mid-14th century. Caused by the bacterium Yersinia pestis, the Black Death spread rapidly through trade routes carried by fleas on infected rats. The disease manifested in gruesome buboes, painful swellings in the lymph nodes, often accompanied by fever, chills, and vomiting. The Black Death decimated populations, killing an estimated 75 to 200 million people in Eurasia. Cities were overwhelmed with the sick and dying, and mass graves became commonplace. The plague's impact extended beyond immediate mortality. It disrupted trade, shattered economies, and sowed social unrest and religious fanaticism. Efforts to control the Black Death were largely ineffective. Medieval medical knowledge was limited, and quarantine measures were inconsistently applied. Some communities resorted to superstitious practices such as flagellation and scapegoating in a desperate attempt to appease divine wrath. The Black Death's legacy extends far beyond its immediate devastation. It reshaped European society, leading to labor shortages, the decline of feudalism, and a renewed focus on sanitation and public health. The pandemic serves as a stark reminder of the devastating power of infectious diseases and the importance of understanding their transmission and control. Smallpox, a highly contagious viral disease, plagued humanity for centuries. Characterized by fever, pustules, and scarring, smallpox was a major cause of death and disfigurement worldwide. The disease spread through direct contact with infected individuals or contaminated materials, leaving a trail of suffering in its wake. Smallpox's impact was particularly devastating in the Americas. European colonists inadvertently introduced the virus to indigenous populations who lacked immunity. The resulting epidemics decimated Native American communities, playing a significant role in European colonization. The fight against smallpox marked a turning point in medical history. The development of variolation, an early form of immunization using material from smallpox sores, offered some protection. However, it was the discovery of the smallpox vaccine by Edward Jenner in 1796 that revolutionized disease control. Widespread vaccination campaigns led to the eradication of smallpox in 1980, a testament to the power of public health interventions. The Smallpox Eradication Campaign serves as a model for global health initiatives. It highlights the importance of international cooperation, scientific innovation, and community engagement in combating infectious diseases. The success of smallpox eradication provides a blueprint for tackling other deadly diseases and underscores the potential of human ingenuity to overcome even the most formidable health challenges. Cholera, a severe diarrheal illness caused by the bacterium Vibrio cholerae, emerged as a major public health threat in the 19th century. Spread through contaminated water and food, cholera outbreaks were characterized by rapid onset, severe dehydration, and high mortality rates. The disease thrived in overcrowded urban areas with poor sanitation, disproportionately affecting impoverished communities. Cholera pandemic swept across the globe, causing widespread panic and social disruption. The first cholera pandemic originated in India in 1817, spreading rapidly to Southeast Asia, the Middle East, and Europe. Subsequent pandemics followed, highlighting the interconnectedness of human populations and the ease with which infectious diseases could traverse geographical boundaries. The fight against cholera led to significant advances in public health. John Snow, a British physician, pioneered epidemiological methods by tracing a cholera outbreak in London to a contaminated water pump in 1854. His work highlighted the importance of sanitation and clean water supplies in preventing cholera transmission. The understanding of cholera's transmission led to the development of oral rehydration therapy, ORT, a simple and effective treatment for dehydration. ORT has saved countless lives and remains a cornerstone of cholera treatment today. The history of cholera underscores the importance of public health infrastructure, sanitation, and access to clean water in protecting populations from infectious diseases. Section 5. The Spanish flu, a global nightmare. The 1918 influenza pandemic, often referred to as the Spanish flu, was an unprecedented global health crisis. Caused by an unusually deadly strain of the influenza virus, the pandemic infected an estimated 500 million people worldwide, killing 50 to 100 million. The virus spread rapidly, overwhelming healthcare systems and leaving a lasting impact on societies around the world. The Spanish flu was unique in its severity and its demographic impact. Unlike typical influenza outbreaks, which disproportionately affect the very young and the very old, the 1918 pandemic caused high mortality rates among healthy young adults. The reasons for this unusual pattern remain a subject of scientific inquiry. The global response to the Spanish flu was hampered by limited scientific understanding of influenza viruses and the lack of effective treatments. Quarantine measures, public health campaigns, and the use of masks were implemented with varying degrees of success. The pandemic highlighted the need for international cooperation and scientific research in combating infectious diseases. The Spanish flu left an enduring legacy on public health. It spurred the development of influenza surveillance systems, vaccine research, and a greater understanding of the importance of pandemic preparedness. The pandemic serves as a stark reminder of the devastating potential of influenza viruses and the need for continued vigilance in the face of emerging infectious diseases. Section 6. HIV/AIDS, a modern pandemic. The HIV/AIDS pandemic emerged in the early 1980s, posing a new and complex challenge to global health. Caused by the human immunodeficiency virus, HIV, the disease attacks the immune system, leaving individuals vulnerable to opportunistic infections and cancers. HIV is primarily transmitted through sexual contact, blood transfusions, and mother-to-child transmission. The HIV/AIDS pandemic has claimed millions of lives worldwide, disproportionately affecting marginalized communities. The disease has had a profound social and economic impact, particularly in sub-Saharan Africa, where the burden of HIV/AIDS remains high. The response to the HIV/AIDS pandemic has been marked by scientific breakthroughs, public health activism, and evolving social attitudes. The development of antiretroviral therapy, ART, has transformed HIV/AIDS from a death sentence into a manageable chronic condition. However, access to ART remains unequal, and stigma and discrimination continue to hinder prevention and treatment efforts. The HIV/AIDS pandemic underscores the importance of addressing social determinants of health, reducing stigma, and ensuring equitable access to healthcare. It also highlights the need for continued research, prevention programs, and support services for people living with HIV/AIDS. Section 7. Ebola, the silent killer. Ebola virus disease, a severe and often fatal hemorrhagic fever, first emerged in 1976 in simultaneous outbreaks in Sudan and the Democratic Republic of Congo. Named after the Ebola River in the DRC, the virus is transmitted through contact with bodily fluids of infected individuals or animals. EVD is characterized by fever, muscle pain, vomiting, diarrhea, and internal and external bleeding. Ebola outbreaks have occurred sporadically in Central and West Africa, often in remote areas with limited healthcare infrastructure. The 2014 to 2016 West Africa Ebola epidemic was the largest and most complex Ebola outbreak in history, affecting Guinea, Liberia, and Sierra Leone. The fight against Ebola has been challenging due to the virus's high fatality rate, the difficulty of diagnosis, and the lack of effective treatments and vaccines. Control efforts have focused on isolating infected individuals, tracing contacts, and implementing strict infection control measures. The Ebola experience has highlighted the importance of investing in public health systems, strengthening disease surveillance, and developing rapid diagnostic tools and effective treatments. It also underscores the need for international cooperation and rapid response mechanisms to contain outbreaks before they escalate into global threats. Section 8, COVID-19, a new reality. The COVID-19 pandemic caused by the novel coronavirus SARS-CoV-2 emerged in late 2019, rapidly spreading across the globe and ushering in a new era of pandemic preparedness and response. The virus is highly transmissible, spreading through respiratory droplets and close contact. Symptoms of COVID-19 range from mild respiratory illness to severe pneumonia and acute respiratory distress syndrome. The COVID-19 pandemic has had a profound impact on global health, economies, and societies. Lockdowns, travel restrictions, and social distancing measures have been implemented to slow the spread of the virus, resulting in widespread economic disruption and social isolation. The global response to COVID-19 has been characterized by unprecedented scientific collaboration, rapid vaccine development, and the adoption of new technologies for disease surveillance and contact tracing. However, access to vaccines and healthcare remains unequal, highlighting the need for global solidarity and equitable distribution of resources. The COVID-19 pandemic has underscored the importance of public health infrastructure, scientific research, and international cooperation in combating emerging infectious diseases. It has also highlighted the need for effective communication, public trust, and adaptable healthcare systems to respond to evolving pandemic threats. Section 9. Lessons learned shaping public health. The history of plagues provides valuable lessons for shaping public health policies and preparing for future outbreaks. One key lesson is the importance of investing in public health infrastructure, including robust disease surveillance systems, well-equipped laboratories, and trained healthcare personnel. Strong public health systems are essential for early detection, rapid response, and effective containment of infectious diseases. Another crucial lesson is the need for international cooperation and collaboration. Infectious diseases do not respect borders, and global outbreaks require coordinated efforts to share information, resources, and expertise. International organizations, such as the World Health Organization, play a vital role in coordinating global health responses. The history of plagues also underscores the importance of public trust and effective communication. Clear and accurate information delivered in a timely and transparent manner is essential for building public trust and encouraging adherence to public health measures. Misinformation and fear can undermine public health efforts and hinder effective disease control. Finally, the lessons from past plagues highlight the need for continuous learning and adaptation. The emergence of new pathogens and the evolving nature of infectious diseases require ongoing research, innovation, and a willingness to adapt strategies based on the latest scientific evidence. Section 10. Conclusion, vigilance, and preparedness. The history of plagues is a stark reminder of the constant threat posed by infectious diseases. From the Black Death to COVID-19, plagues have shaped human history, leaving behind a legacy of death, disruption, and resilience. As we navigate an increasingly interconnected world, the risk of emerging infectious diseases remains a significant challenge. The lessons learned from past plagues provide a roadmap for strengthening public health systems, fostering international collaboration, and promoting public trust. Investing in disease surveillance, research, and healthcare infrastructure is essential for early detection and rapid response to outbreaks. Effective communication, transparency, and community engagement are crucial for building public trust and encouraging adherence to public health measures. International cooperation and the sharing of resources and expertise are essential for mounting a coordinated global response to pandemic threats. The history of plagues reminds us that vigilance and preparedness are essential for safeguarding human health. By learning from past experiences, investing in public health, and fostering global cooperation, we can strive to mitigate the impact of future outbreaks and build a more resilient future.